So, our first speaker joining us by satellite link is Daniel Kraft. Daniel is a physician scientist, an inventor, an innovator. He is a pilot, flight surgeon in the California National Guard. He's the founder of a number of fascinating sounding companies, all of them seeking to move us into a whole new world of mobile technology and healthcare. So I hope very much we'll soon see or hear Daniel Kraft, and look forward very much to hearing what he'd say. Daniel.
Good morning. It's terrific to be with you across the pond. I was actually born in London, in Hampstead. I left too young to actually keep the great accent, but it's a pleasure to be with you. And in this 20 minutes or so, I'd like to take a look at a little bit of the future of healthcare, also connected to the future of mobile, and sort of paint a picture of where healthcare can potentially go in a variety of ways. So I thought before we look into the future of medicine, it's a little helpful to look at the present and a bit of the past. I was fortunate to do my medical training in Boston at Massachusetts General Hospital after medical school at Stanford. I trained at Massachusetts General Hospital in both internal medicine and pediatrics, and I was there about a year and a half ago for the 200th anniversary of Mass General Hospital. So this is a chance to have a reunion with the house staff that I trained with, the guys and girls you went to war with as an intern and resident. And, of course, being in Boston, which is a challenging place right now, as we know, we used to joke we'd walk uphill both ways in the snow. And I found myself, after one of the receptions at Mass General, one of the most famous places of healthcare history. This is called the Ether Dome. This is where, in 1846, this lucky gentleman was the very first patient to get general anesthesia with a surgery. Before 1846, patients were sort of biting the bullet, should we say. So they invented sort of general anesthesia there, and that room where this happened is called the Ether Dome because they administered anesthesia with ether. And today that room is sort of a shrine to medical history. Hasn't changed in over 150 years. We have some special grand rounds there and meetings. And I found myself thinking about history of medicine. I wandered about 4 minutes away to the ward where I spent my first month as a brand new doctor. And that also was sort of frozen in time, hadn't changed in over 15 years. Some of the same alarms were beeping, some of the same nurses, some of the same patients. And the only difference was that the poor young intern there was pushing around a medical cart with an old computer, had to both print out his medical record and put it into the paper charts. And this is at Massachusetts General Hospital, terrific institution. But my sort of thought was that today medicine's still practiced very much as it's been done for over 100 years, very much in silos and based on departments and fiefdoms. Often the information doesn't flow in a variety of ways. And we're practicing medicine sort of based on old metrics. And we know as individuals now and as physicians and clinicians that we're now in the molecular age of medicine. We're much more than a bucket of body parts or a sundry parts of various ologies and specialties. And I think in this new exponential age of technology, we have the opportunity to rethink and reinvent healthcare. And I think whether you're in the U.S. or Europe, we have major challenges, whether it's the amount of our gross GDP that we dedicate to healthcare. How do you get access to medicine here in the U.S.? Even with Obamacare, we still have 70 million patients who don't have great access to primary care physicians. How we practice medicine differently in London than in Boston than in San Francisco for the same exact case. We have a lot of inefficient use of information. A lot of data is coming out of us, but it's not often useful or used. And of course, we have the challenges of healthcare innovation that have to happen in the practice of reimbursement and the regulatory process, such as the FDA that we have here. But I think there's a bit of an opportunity to change how healthcare is performed, particularly in where, at least in the U.S., sadly, we don't really practice evidence-based medicine. We practice reimbursement-based medicine. We practice where the dollars go. We get what we get paid for, which is often the end-of-life care. We know that about 80% of our healthcare dollars are spent on the 20% of the chronically ill, the last couple months of life. We practice sick care, not necessarily health care. But the incentives are starting to shift, and that can happen in the British system and others, to keep people healthy, spending more dollars on prevention. And some of the technologies, particularly in mobile health and apps, are enabling moving that curve to the left and in prevention. Another major trend that's happening is moving where medicine happens, from the hospital and the ICU to the step-down unit, and more to our homes, and increasingly, as we'll talk about, onto our own bodies. So those are some major trends that are happening across healthcare in a meta sense. But where this is being enabled, including making medicine better, cheaper, and more affordable, is through some of the technology advances that have happened even in the last 10 years or so. Since I left Boston and came back to Stanford for fellowships, a lot of things have been moving very, very quickly. And I like to describe those technologies as exponential. Our minds tend to think linearly, 1, 2, 3, 4, 5. If I took 30 linear steps, I'd be out the door, down the hall. But if I took 30 exponential steps, 2, 4, 8, 16, 32, by 30 steps, I'm at 1 billion. That's 64 times around the planet. And our minds don't often understand that exponential movement. We see that in technologies like Moore's Law that's affecting computing. The fact now that the smartphone in your pocket has about 1 billion times the price and speed performance of the best supercomputers of the 70s, or your iPad is as powerful as a Cray supercomputer from the 80s, is testament to the power of exponential trends. And that's happening not just in computing, but in a whole slew of technologies. And they're starting to converge, sort of having a superconvergence, not just IT, but in mobile elements and social networking, and even elements like 3D printing and genomics. And we have the opportunity to layer those technologies on top of each other to impact especially mobile health, but many elements of healthcare. So we've reinvented many things even in the last decade. How we read books has dramatically changed. Now Amazon sells more ebooks than regular books, so they've disrupted themselves in a sense. We've changed the way we take photos, for example, and now sadly Kodak has been disrupted, and companies like Instagram, for example, have a market cap 100 times fold Kodak. So they've gone away in a sense when they've not understood the pathway and speed of, for example, digital photography. Now, we're seeing exponential trends also in medicine. One example is obviously in genomics. What used to be $1 billion genome is dropping at twice the speed of Moore's Law, to the point where we're essentially now at $1,000 genome, and soon we'll be at a $100 genome, and maybe even less expensive than that in the next coming years. And it's not just genomes sent to the laboratory. Some of that can be done at the point of care. A USB chip, several of which have been developed in the UK, can enable pharmacogenetics done at the point of care. And of course, it's not just your genetics that's getting cheaper. It's proteomics, it's environmental data, it's imaging data. And high-speed computing is enabling, for example, the surgeon to reconstruct images of the patient in real time and do much more effective and directed and individualized therapy using high-speed computing and imagery to reconstruct the patient and do, again, better planning and directed therapy. We're seeing high-speed computing now looking inside our brains. Here in the U.S., we just launched an initiative to map the brain. So we can not only see the amazing anatomy, but now the connectome. How is the brain connected in different ways? How is it in normal states and in, let's say, psychiatric disease? How can we better understand and even reverse engineer the brain to build the next generation supercomputers? So we're starting to look inside the brain in real time and hopefully meld the world of, let's say, psychiatry in a much more directed and focused way through better and faster imaging enabled by Moore's Law and the world of high-speed computing and imaging. It's going to disrupt several fields like the traditional angiogram. We know about putting the catheter up to the heart, imaging the heart with dye. It takes about an hour in the cath lab, a lot of radiation. Well, now with high-speed computing, a startup out of Stanford called HeartFlow can reconstruct your heart. A 30-second CT scan sent to the cloud can now calculate the fractional flow reserve in your coronary artery, determine how narrow that is, just as what used to be done with a catheter and a cardiac measurement, can now be done computationally. And what will that patient do with a stent, for example? What kind of stent do they need? That can be done now through computational cloud-based calculation. That will disrupt diagnostic cardiology, for example. Or a 10-minute cardiac MRI can now do what an echocardiogram can do. So you can even see that on your iPad or your computer anywhere in the world. The cardiologist and the patient can see how their heart is functioning and get all the data that used to take an extensive cardiac echo done, again, through computation. So, of course, it's not just computation that's in diagnostics or in imaging. It's coming to our smartphones. That's, again, the example of Moore's Law at play. And the phone has really emerged as a medical device. Increasingly now we have, at least in the U.S., about 70% of physicians bringing tablet computers to work. At Stanford, where I'm based, every medical student gets, say, an iPad their very first day of school. So the new physicians and patients, I would argue, are getting connected in new and powerful ways. And these provide the ability to have a dashboard. When you can have a connected glucometer on your smartphone, that can then give you a dashboard to you as a diabetic or as a physician to your patient's data, and you can see that information, the trends in glucose that correlate with their activity, which correlate with their diet. you might be able to make smarter moves to optimize the medications, for example. And that's been studied. For example, a company called WellDoc did a study where just the patient would record their blood sugar. The physician would see those numbers and trends, and it would adjust, let's say, their metformin and other meds, and they were able to lower, on average, hemoglobin A1C by 2 points. That's better than any blockbuster drug. The control group was about 0.7. So how long will it be before we prescribe apps instead of just medications? And that's been shown in studies to help lower and maintain weight loss. And I think in the near future, as clinicians, we'll be prescribing specific apps to our patients, like a knocked up app if you happen to be pregnant, or a knocked down app for post-op care for after orthopedic surgery, for example. And so we have the opportunity to retool how we see information, how we share that using some of these mobile and smart devices. We can add the elements of gamification. We know that medical adherence or compliance is quite difficult. We can now incentivize patients to stay on top of their meds with sometimes simple games and points, but sometimes even more complex games. Speaking of gaming, we can use low-cost gaming technologies like the Microsoft Kinect, not just to play a sports game on your TV, but now to measure your motion. So if you're trying to do physical therapy, we can add a layer that can measure motion and compliance and actually make that more fun and engaging as well. So adding gaming technologies to the world of physical therapy as an example. Now, this is this new world of digital healthcare. We're digitizing all this data, not just our vital signs, but other information from our environment, our genetics. We can pull that together in smart new ways, and part of that, again, is being enabled by mobile. Our phones now have a number of sensors that can be used in very, very smart ways. One of them, for example, a company based out of California called AliveCore has developed a special EKG case. So if you see the phone case I'm wearing, it has 2 leads in the back. And now I can actually hold that phone, and just with my 2 thumbs on the back, hopefully you'll see here, if I'm not too nervous, my EKG. This is a live EKG through my smartphone. This can be done on any smartphone platform now. And you can see this EKG being recorded in real time. This could be then sent directly to my cardiologist. This could be utilized by my cardiologist or shared or used by a triage nurse or by an ambulance driver to get an EKG directly. Just by holding that case, the patient can have an EKG that can then, again, be transmitted anywhere. A patient with arrhythmia, like atrial fibrillation, could watch their heart at home and adjust their medications. So this is just one example of mobile technology coming to the phone. We're seeing other examples of that. I'll just move back for 1 second. The camera can be used to look at the eye and do eye diagnostics. There's attachments to look in the patient's ear, so for pediatrics to look at otitis media, glucometers that can be attached. And so this is being enabled by a new era of what's being called the quantified self, or increasingly quantified health. There's a whole new sphere of devices and technologies which can be connected to measure various aspects. How many steps I've taken, how much I weigh, or, for example, blood pressure. In the U.S., 1 in 3 patients has high blood pressure, but less than half of them are controlled. What if, as a doctor, I prescribe a patient not just drugs, but a blood pressure cuff and a way to see that feedback loop and adjust their medications? So we're seeing new dashboards and ways to sense things, including when we get fancy tattoos that can measure vital signs and fall off after a week. So if someone's discharged from the hospital, you can track them in an easy way. We're seeing other dashboards that we can wear as patches. I am actually wearing a small patch on my chest that I will open up here, the app. It's called a company called Vital Connect. I'm now not touching anything, but I'm wearing a patch on my chest, and this is streaming my EKG to the web. Again, it's a dedicated EKG you see here. Similar, but I'm not touching the leads. I can also, by the way, on the phone or stream this to the web, see, for example, my stress level, and again, a dashboard into my data coming directly onto my phone and transmitted anywhere on the planet. So this is a more complex sensor. It can also tell my position. If I fall down and I stay down, it could call an ambulance, for example. It can track my steps, my calories, and again, an embedded dashboard that is useful and will be useful in a variety of ways. It's not just diagnostics from our body, it's diagnostics at the point of care from our blood, from our urine. We're now in the era of point-of-care diagnostics, microfluidics, for example, where a single drop of blood, for example, instead of a microliter, can be used to, for example, diagnose malaria and tell which type of malaria it is and how can it be treated. We're seeing the ability to print off laboratory strips, for example, at the point of care. So anywhere on the planet now, we can get point-of-care diagnostics and do essentially a digital checkup. You can buy with telemedicine, just like I'm speaking to you remotely. You can visit a physician through telemedicine apps and have point-of-care vital signs as well as laboratory data. So it's all these information layers layering up in smart new ways that has the opportunity to allow us to reinvent healthcare. It can be now our connected devices, some of which are in our bodies, so smaller pacemakers, many of which now have IP addresses, which means they can connect with an app, but potentially they can also be hacked. So if I had an implantable defibrillator, I might get a call, an SMS saying, Dr. Kraft, go to the bank and take out 100 pounds or I'm turning off your pacemaker. Or I might be tweaking your insulin pump. So other opportunities and challenges. Other challenges are who owns the data. My friend Hugo here has an implantable AICD defibrillator, but the company who makes his defibrillator won't give him his own detailed data. Who owns that information? You or the company who makes the device? Now, as clinicians, as doctors, as nurses, anyone in the healthcare world, we're now being besieged by more and more information. How do we make this smarter? How do we get smarter through technology? How do we keep up? Well, one realm that's enabling that is the world of artificial intelligence, or as I like to call it, not AI, but intelligence augmentation. And many of you saw 2 years ago, IBM developed a system called Watson, which is now, it beat the two champions in the game show Jeopardy, but it's now being applied to healthcare to do better workups and diagnostics, but also at the point of care to suggest the best therapy or the best overall course or how to monitor and optimize a healthcare system can be using AI. And we're seeing AI come to all of our elements. We already have elements in our cars and our phones. With all these data feeds, how do we make sense? We can't just look at heart rate or vital signs or steps. We need the equivalent of what's in our cars, like an OnStar for the body that has your own check engine light that says this patient's getting in trouble or your emergency ward's going in the wrong direction. Take a quick look, head things off. So I think we'll see the integration of this data just like you have check engine lights in your car. So we're entering this era of smart connected devices, connected to AI. Many of you might be Star Trek fans, might recognize the medical tricorder. And we now have essentially tricorders in our pocket. What used to be a $100,000 ultrasound can be an ultrasound that now fits and connects to our smartphones and tablets. And in fact, there's now a competition sponsored by the X Prize and Qualcomm of $10 million to have teams create a mobile connected device that can enable a consumer at home to measure things that we can normally only do in the clinic. And several companies, over 200 companies, have entered this competition. One of them called Scanadu, based at NASA, where I work in the Silicon Valley, is developing a technology like this. This is where they see this heading with mobile and connected technology in the next couple of years. Take a look at the video.
Technology has given us an unprecedented window into the human body. But on a day-to-day basis, we're still in the dark about our own health. We are changing that. What if instead of fearing the worst when you notice something out of the ordinary, you could identify the condition yourself? Getting the right diagnosis would save you worry.
It says it's roseola.
And an unnecessary doctor's visit.
Rest at home. It's okay. It's okay.
Instead of hearing about a viral outbreak on the news, imagine you got an alert that was tailored to your family's needs. It would also give you advice about what to do next. What if you had a way to identify what was wrong right away?
It says it's 103.8.
A way to get all of the information you need to understand the situation. And in serious cases, you would know when and where to seek help.
Yeah, it recommends taking it to the urgent care.
We're building a way for people to check their bodies as often as they check their email. It's all possible, and it's only the beginning.
So that's an idea, a vision of where this technology can come to and integrate in the near future. And for example, this company Scanadu has built a technology where you hold the device to your forehead and you pull up a whole set of vital signs and can communicate that to your clinician and make smarter decisions and see that in real time and hopefully avoid the ER visit at 2 in the morning that's not necessary or to go when you actually need that. Again, a smart mobile technology. So this enables us to connect to our clinicians and to ourselves in new ways. So the connected network, the social network, is a very powerful element of medicine and even instigating behavior change. Where your friends are and what your friends' friends are doing can impact your own health and habits. And in fact, our costs from our behavior are much more expensive than the cost to develop platforms. For example, a startup out of San Francisco is enabling pre-diabetics to move off of the danger range by connecting them, enabling social networks of other folks who are pre-diabetics, connecting them to scales and connected data. We're seeing the ability now to look in the mirror, for example, and see, how are you going to look if you really get in shape, and have sort of an augmented reality view of your future, or what happens if you keep eating junk food, for example, and go in the wrong direction. You can already download apps that will give you insight into what you look like today and what happens if you gain 50 pounds or 100 pounds. That might change what you have for dessert, for example, this afternoon. So we're enabling the connected patient. We're also starting to enable the disabled. We're now in the world of connected robotics or exoskeletons. A company called Exobionics has developed a wearable exoskeleton so a paraplegic can walk who no longer could, wearing an exoskeleton. This is just coming to Europe, for example. For those who are disabled with spinal cord injuries, where we hope to go is to really cure them. We're now in the world of induced pluripotent stem cells. The Nobel Prize was won last year for developing the ability to take a skin cell, turn that to almost any tissue type. That's going to be combined with the world of 3D printing. So we're now in the world of 3D printing. I'm wearing a 3D printed ring. I'm actually wearing a 3D printed belt. I have in my pocket a 3D printed version of my head from a simple scan. I'll try and pull that out and show you. So little mini-me right here. So 3D printing can be fun for developing little widgets, but it can also be used in healthcare, for example, to print a prosthetic leg that matches one that might be missing. It can be utilized to use advanced bioengineering to eventually print tracheas and seed those with the patient's stem cells, or eventually print complete bioorgans. That's where that might be heading. So a lot of technology is moving very quickly. How do we appreciate that? We also have to understand how we pay for that, because we, again, don't practice evidence-based medicine. We often practice reimbursement-based medicine. I've been looking at this through my role as the chairman of the medicine track in a new program institution called Singularity University. Singularity University is based at NASA in Silicon Valley. We look at medicine, biotech, robotics, artificial intelligence, thinking about where technologies are, where they're heading, and how we can leverage those to address global challenges, including poverty, education, and medicine around the planet, and including ways to use maybe drones to deliver drugs and vaccines, or develop telemedicine gloves that can be used by a patient or a physician to do better diagnostics. I run a program that started there 3 years ago called FutureMed, where we bring together doctors, nurses, technologists to look at where technology is going and how can we reinvent medicine in smart new ways. So if you go to futuremed2020.com, you'll see a lot more information, but it's enabling us to rethink and reinvent healthcare. We're going to do a new program in November in San Diego. So FutureMed, check that out. So what these programs are doing, and many things that are happening in healthcare, is bringing folks with beginner's mind, new thoughts into healthcare, not just doctors and nurses, but other technologists. We're using open data. We're having health hackathons. We're thinking about how can we reinvent medicine, including through the world of design thinking. I think you're going to have Michael Gray speaking to you later today, who's thinking about design. We can bring the elements of the design world, for example, the world of flying, and I've been a pilot, as was mentioned, and a flight surgeon for many years. How do we take lessons from aviation, the systems approach in aviation? I think you had a speaker at the conference who's from the flying world. There's lessons from aviation that can be applied, for example, and just some flying pictures of me in the past, and in the world of aviation medicine and military world. We can take lessons from aviation, for example, the checklist. The checklist has now been taken to the operating room and is dramatically lowering cost and mortality and morbidity when you can do smart checklists. And that's not just happening in the operating room, but in the post-op world and for patients, and we're appifying checklists. We're using the world of simulation. So that saved lives in the world of the cockpit, but what if we can simulate medical procedures? So now, for example, at Stanford and many other places, we have simulation labs where instead of see one, do one, teach one, it can be see one, do one, do one, or see one, sim one until you get it right, and you can practice with teams and learn and improve. We're using the world of heads-up displays, just like in the fighter cockpit world. We've gone to digital cockpits. You need different information if you're landing in the snow or if you're in a dogfight, and you can also have other information that's going to warn you that you're about to hit a mountain, for example, and it'll tell you in your ear, pull up. So we can use smart data, as we have in our cars as feedback loops, to give us a healthcare GPS, to point us in the right direction. We want just the right amount of information, though not too much information. How do we not overwhelm ourselves as patients or as physicians or as well? We can use new layers of information to port that to our eyeballs, right? We're now coming to the world of Google Glass, and we'll see that play an important role, I think, in healthcare. When you can see information ported to you, it can be kind of fun. We can use that in the world of maybe you're on a date, you can pull up a special app and get additional information about who you might be across the table with, so sort of fun applications. But you might think about how that could be utilized, for example, in the operating room to see data in new and powerful ways. Or if you're someone trying to lose weight, maybe you see your food like this now, but maybe you'll see it with the calorie take in the future. Maybe you'll get another warning in your ear about pulling up after you've eaten too much. Okay, our last few points from aviation would be radar. What if we could unsilo that data, see where the thunderstorms were, calculate where the right path was to go with a certain disease? Just like you can build a map of Rome using a driving app. This is a map of Rome built in real time, sort of crowdsourcing data. What if we start to crowdsource medical data when we can see the maps and where the traffic jams are and share data between our electronic medical records and understand where, for example, the influenza is in a certain neighborhood? So, in summary, with mobile connected technology, where we used to be flying blind, we can now see the world in new ways. We might, again, have a bioweather map and see in what neighborhoods we have problems like influenza and make better, smarter diagnostic decisions. We can now look at the social network and mine that and know, by the way, who should I shake hands with or not that day based on social network feeds and other information. We can use dashboards into our data enabled by smart mobile apps and connectivity to see insights into our own data and those of our patients and our healthcare systems. So I think the future will be integrated systems approaches, contextual, big data enabled by artificial intelligence. We should use design thinking to make smart user interfaces so we're not overwhelmed by this, so we can use it in smart ways. We're going to move from a world where healthcare is much more episodic and reactive, where we get a blood pressure or a blood test when the pain happens, when the acute problem changes, to a world of healthcare information that's much more continuous and proactive. And that's enabled by this new era of smart, cheap, small, connected devices, whether that's a blood pressure cuff or a scale that tweets your weight or more advanced diagnostics and apps. And where I hope this goes is it enables a world where we're not just used to being a blood donor or an organ donor, but one where we can be data donors and unsilo that information in smart, new, impactful ways. In my world of oncology, I hope that enables personalized oncology, where every tumor is sequenced and utilized in smart ways, and mining that information and sharing that can give us smarter, directed, more curative realms in health and oncology. So I challenge you to think about where are trends going exponentially? How can we reinvent elements of health and medicine by bringing technology together, reinventing things, just like we've reinvented banking and how we read and how we share photos and how we get the news. And so in many ways, these technologies are moving very quickly. Some of them are here today. And as William Gibson once said, the future is already here. It's just not evenly distributed. And I think those of us here in the healthcare world can not just predict that future, but we can create it. And so I challenge you to help reinvent the future of medicine by integrating smart technologies and inventing a bold new world of health and medicine. Thanks very much.
Daniel, thank you so much. You can't see us as well as we can see you, but there are many open mouths in the audience. I think people are feeling, if anything like me, rather dizzy from that incredible tour de force of showing us what's possible. Thanks to Paul Lomax and to you tweeting in the audience. I've got a couple of questions for you, Daniel. The first is, fantastic to see all this mobile device and sharing of patient data between the patient and the professionals. What about confidentiality? Is this secure?
Well, I mean, definitely we need to think about privacy and confidentiality. I think we're already in the Facebook era and we're used to sharing more information, and many patients want to be engaged in sharing the information. We're now in this world of participatory medicine. You saw Jamie Haywood, my friend from Patients Like Me. Patients want to share their information. But of course we need to be careful about privacy. I think, though, we shouldn't squelch innovation. Here in the US we have something called HIPAA, HIP, Healthcare Portability, which in some ways hinders progress at the price of confidentiality. I think using smart technology and being able to opt in and share, let's say, your genome and in de-identified ways where you're driving, for example, can help enable unsiloing of data and better, smarter outcomes. But yes, we need to be mindful of that, as well as the fact that increasingly these devices can be hacked in interesting ways. Someone can take your DNA from your glass and sequence you today as well, which leads to interesting implications on privacy.
Thank you very much. And a final question. Is there a potential for this all to just make us a great deal more anxious about our health? And what about the medicalization of normality through all of this technology?
Well, I come from the Silicon Valley. We have a lot of data geeks. I'm wearing multiple connected devices like a watch that will track my heart rate and my steps and my sweat and my stress level. I think what this is going to go, these are still sort of sensors 1.0. It'll track a single vital sign, for example. Where this will move is to a world of Internet of Things, where this will be ubiquitous. It'll connect and look at our data. The mattress that we sleep on will look at our vital signs. And we'll only get that heads-up display, that check engine light, when something's trending in the wrong direction. We can move to sort of stage 0 or stage 1 medicine instead of finding things at stage 3 and 4. So hopefully we can be less worried. The fact that we know our check engine light might be lit. Of course, some people will be obsessive about their data. I think the trick is to dial up and down your sensors and your data stream so you're not overwhelmed by this. But I think if we design this in smart ways with design thinking and smart user interface and recognizing individualized psychology and behavior change, we can get around that. But still an opportunity and a challenge. Again, through connected healthcare and data, we can optimize our own health and our healthcare systems, but we have to utilize that in smart and insightful and thoughtful ways.
Daniel, thank you very much indeed for an entirely inspiring talk. Lovely to see you as well. Thank you so much.
All right. Cheers. Thanks.